ทุกคนเห็นสไลด์นะครับ
เห็นค่ะ
โอเคเริ่มเลยนะครับOkay, today we will talk about the basic concept of radiography, especially cardiac part. That is the part or principle of non-invasive cardiology, investigation, and echocardiography. Okay, in this class, we have 6 topics that will be discussed. The first basic concept of radiography. We will talk about types of radiation modality and how do we create the radiological image. The second, the general radiography, especially CXR or chest X-ray. Why we use chest X-ray in cardiology? How does it tell its disease? The third, ultrasound. We will learn about what is ultrasound, the basic from the previous week. Okay, the fourth, computed tomography. We will talk about benefit, image production, and the final magnetic resonance imaging or MRI. We will find out how are they different from another modality. And the final nuclear medicine is its complex method for cardiac non-invasive technique and how we get image from this technique. Okay, let's start for the first topic in this section. Okay, the first step, we should know about radiography image for another modality. That image in smartphone. That is chest X-ray, which is created from general X-ray machine. In cardiology, it is used for cardiomegaly side, and we will learn in next topic. That's image in PC monitor. That is ultrasound image, which is created from sound wave. Ultrasound have several techniques for cardiac evaluation, such as Doppler mode, and that is displayed on this slide. Okay. On our left-hand side, this is cardiac CT or cardiac computed tomography image, which are created by computed tomography scanner with reconstructed technique. And another side in this, okay, this is MRI or magnetic resonance imaging with 4D blood flow technique. And the final image, there are myocardial perfusion images, which are created by nuclear medicine scanner with radiopharmaceutical or radio tracer. This technique is used to estimate organ physiology and metabolism, while another modality are used to assess the anatomy. Okay, from this slide, we will discuss about meaning, underability, and benefit of radiology modality. The first is general X-ray machine. X-ray are often used for screening tests such as chest X-ray or CXR because that are quick painless for examination procedure. We just lie, sit, or stand close to imaging receptor pad. The procedure takes about 10 or 15 minutes. From this X-ray image, we can get 2D information about bony structure or anatomy of a patient in thoracic area. The next is CT scan or computed tomography scan. That is used to create cross-section image or another name that tomography. For procedure, we will lie on table or couch and that slide into scanner while X-ray tube or X-ray sword loaded around patient's body to take cross-section images. This procedure takes about 10 to 15 minutes or 20, depend on area of organ that you will study, especially cardiac CT take about 20 minutes in all process. This cross-section image, we can get 3D information, 3D information, left, right, front, back, and head, foot, side. เดี๋ยวนะมีคนขอเข้าเหรอ Okay. Continue. This slide for MRI or magnetic resonance imaging. This modality can create medical image by using magnetic or radio wave. This is different from the previous two modalities that use radiation or ionizing radiation to create images. Due to MRI used for magnetic field, it takes a long time to examine around 45 to 16 minutes. MRI images are often used for estimate tissue integrity that CT cannot provide that information. Okay, this slide is ultrasound. We have learned in previous week. Okay, we have used in echocardiogram that use high frequency sound wave to create 2D image. The important tool is ultrasound probe that is used to send and receive radio signal by echo effect. This procedure takes around 30 to 60 minutes and using for screening and guide biopsy. Okay, the final is nuclear medicine is the most complex examination by using radioactive drugs or radiopharmaceutical that is run or injected into patient body, and radiation will emit from patient body to detector or scanner. That procedure takes 1.5 to 2 hours and give 2D and 3D image depend on scan technique. Nuclear medicine is used to investigate organ or system function. Another meaning is physiology. Okay, before we move to next topic, we will conclude and clarify by using image type, this 2D and 3D, and imaging source, use radiation and not use radiation. Okay, the first is CXR or shade X-ray from general X-ray. CXR is 2D image and use ionizing radiation or radiation, and ultrasound, this ultrasound or echocardiogram is 2D image and use radio wave. For CT or computed tomography is 3D image and use ionizing radiation. For MRI or magnetic resonance imaging, it 3D image and use magnetic field. For nuclear medicine or stand stand for NM, is 2D and 3D image and use radioactive material or radiopharmaceutical. Okay. For the basic concept of radiography, the first factor of radiographic imaging that is attenuation. Attenuation. The one of phenomenon is used to create radiography that is attenuation. Attenuation is the process of reducing the intensity of radiation and its part to the body. If the body have high thickness, density, and atomic number of human tissue, radiation intensity and signal will be reduced more. Okay. In this image show about relationship between high and low attenuation area on chest X-ray image. We can see on the center right that it vertebral spine bone, which had high density. When radiation pass through this area will reduce more than another area. And this lung tissue, this is low attenuation area. Okay. Everyone can scan this QR code for more information about linear attenuation coefficient. That is the important factor about radiography. Okay, this is attenuation. Okay, the first breaking quiz for basic concept of radiography in this class. Okay. The first question for this session isที่เฉลยไปแล้ว ไม่เป็นไร Okay, how are CT and MRI same and different? Okay, answer. Same CT and MRI give 3D image type and different. CT use radiation, but MRI not use radiation. Okay. ลืมตั้งเทคนิคมันเฉลยเลย Okay. Let's talk about the basic imaging of radiology. That is chest X-ray or CXR. Okay. We will talk about device, process, and interpretation. For chest X-ray, we will talk about Cardiothoracic Ratio or Ctr. Okay. That you to estimate size of heart or human heart. Before taking about that, we should know that it's chest X-ray. Chest X-ray is chest X-ray use ionizing radiation to produce image of the inside of the chest, and that is non-invasive medical test. It's mostly used for screening and diagnostic. For preparation for CTR or chest X-ray, patient will remove their crosses or accessory from examination part. Moreover, pregnant women cannot be radio photographed. That image show patient's position and machine setup. For guideline recommend, the image receptor must be 180 centimeter or 71 is from the radiation source. This is a radiation source and this is our image receptor. Okay.
Power off.
And we will get the bed chest X-ray image. Okay. Everyone can set distance from X-ray source to image receptor around 180 centimeter.
Power on. Off in mode.
Okay. From the previous slide, that is PA. This is the PA or posterior anterior position shade X-ray. That is a most common position for shade and cardiac screening. PA or posterior anterior come from the direction of radiation from the back. Radiation from the back to the front of patient and onto the receiving plate or imaging plate, okay, behind this machine. Moreover, it also reduces the inaccuracy of the heart image from the enlargement or magnification of imaging. Okay. This is a suitable image for CTR or chest X-ray. Okay. For the important, don't forget we will set up X-ray distance between image receptor and X-ray source or X-ray tube around 180 centimeter or 71 inches. Okay, this slide will expand how do we get information from chest X-ray that you to direct about sign of heart or cardiothoracic ratio or CTR. Okay, this procedure we have to use two values from two lines. The first line is orange line. Okay, the first line is orange line. It measures from the maximum horizontal of cardiac diameter. Okay, maximum horizontal from cardiac diameter. Okay, from one side to another side, and the second line is blue line. Okay, it measures from maximum horizontal of thoracic diameter. After that, take the first line divided by second line, and we will get Ctr score. For Ctr score, interpretation, okay, normal Ctr score is 0.5. But that is more than 0.5 in adult or 0.6 in newborn that are cardiomegaly, and everyone can scan this QR code for more information about calculation of CTR or cardiothoracic ratio. Okay, there are comparison image between normal and abnormal size of heart. This is okay, normal patient and cardiomegaly patient. The next the question, what is normal value of cardiothoracic ratio or CTR? This question ณภัสสรครับณภัสสร
ค่ะ
เท่าไหร่เอ่ย normal value of CTR
0.5 ค่ะ
0.5
น้อยกว่า 0.5
yeah okay less than 0.5 okay. The second quiz is why use PA position for cardiothoracic ratio or CTR test? This question to Nuru Iman ครับ Nuru Iman อ้าวไหนไปไหนอยู่ไหมเอ่ยนูรุอิมานอยู่ไหมครับไม่อยู่เหรองั้นเอาชื่อใกล้กันนะกัญญาครับกัญญามิสกัญญา
ฮัลโหลค่ะ
จ้าทำไมต้องใช้ท่า PA ในการถ่าย
เพราะว่ามันจะ accurate ที่สุดนะคะ มันจะไม่ show enlargement ของ the structure หรือเปล่าคะ
ใช่ไหมเอ่ยมาดูซิโอเคนะครับใกล้เคียงนะครับก็คือความหมายเดียวกันเนาะthis okay that's correct reduce magnification of patient's heart image
อาจารย์คะ
จ้า
คือตะกี้นูนเขาเปิดไมค์ไม่ได้อะค่ะ ก็เลย
อ๋อโอเคไม่เป็นไร โอเคงั้นเดี๋ยวเราไปต่อนะครับ Okay, next topic, we will study about how do we create cross-section image. This topic is computed tomography or CT. Okay. This image is schematic of CT structure inside. Okay. This is represent mechanism or process of CT. In currently technique nowadays technique of CT or cardiac CT, we use spiral CT technique. What is spiral? Spiral is line is DNA spiral. For the CT technique, spiral that means countable will move into grantee. In the same time, accelerator and detector rotate around patient. This is represent pathway of radiation. Everyone can see that line spiral. Okay, this is spiral technique for CT that you took investigate about cardiac CT. Okay. The blue line represent pathway of accelerator around patient. In the same time, countable will move into gantry. The line rarely is spiral. Okay. Okay, there are cardiac. This is cardiac CT image. We can see brightness area in heart chamber. This is okay. Brightness area in heart chamber. We will know how did it happen from next slide. Okay. One of the important factors of cardiac CT is slide number per rotation. What is slide number per rotation? That is slide number or CT image that create from accelerator rotate in one time. This is image represent one slide technique. Okay, one slide CT. When accelerator or accelerator rotate one cycle around patient, that machine get one slide or one image. But this machine, one time for rotate of accelerator around patient, this machine can get many images from one time of rotation of CT of accelerator. Okay. Such as 40, this is 64 slide per rotation, we will get 64 slide CT image from one time of accelerator rotation. And suitable slide number per rotation of cardiac image CT tomography examination shoot more than 64 slides per rotation that can get good resolution for cardiac examination by CT machine. This slide will tell you about a comparison between more than and less 64 slides per rotation. If we use less than 64 slides per rotation in cardiac examination, we will get low resolution or blur image. Okay, everyone cannot see anything in heart chamber. Okay. That can on this cannot interpretation because the heartbeat or the time. Okay, for suitable image for cardiac imaging by CT scanner, we will use more than 64 slides per rotation. Okay. For cardiac CT, the principle are the same as for other examination, but cardiac CT have used some agent, okay, that can increase resolution and difference between cardiac muscle and heart chamber. That is contrast media. Okay. Because the main component of the main component of blood in heart chamber or another area is water. Water has low radiation attenuation, so we will increase attenuation property by using contrast media. For CT contrast media, we use iodinated or iodine contrast media because iodine is radio product that can increase image contrast resolution. This slide shows the difference between used and not used contrast media in cardiac CT examination. One important thing is to be aware iodinated contrast media cannot be used with patients who are allergic to seafood or iodine. For cardiac CT process, the first patient will be examined kidney function by using BUN, creatinine, and GFR. Okay, GFR test. The normal value of BUN is 10 to 20 milligram per deciliter, and creatinine around 0.5 to 1.2 milligram per deciliter. It is normal level of kidney function for normal patient. Okay, next patient will be mature heart rate that should less than 60 beats per minute. Because if heart rate is more than 60, CT image may be blurred or cannot interpretation. Next, scan and interpret. Okay, not only contrast media can increase brightness in heart chamber, but also that can increase in coronary artery. From that procedure, we can use to estimate patient coronary artery in CT coronary angiography or CTA. This is CTA image. Everyone can see pathway of coronary artery. Okay. There's a line with cardiac muscle. This is a 3D image from CT reconstruction. Everyone can see 3D image of heart. Okay, that image we will see CTA image from 3 patients. For the first patient has normal image, and next patient has coronary stenosis and calcified, and the patient 3 had luminal narrowing. This is coronary stenosis. This is okay. This is called coronary stenosis. Okay, and this is for patient 3 have ruminal narrowing. Okay. Everyone can see this gray zone is coronary wall. Okay, and this is blood flow of contrast media. Everyone can see it's narrow comparing with another area. This area or this zone is narrow. This is ruminal narrowing. Okay, that's it. Coronary artery calcium scoring or CACS. This procedure used to estimate calcium level in heart chamber and coronary artery, and we can scan this QR code for more information about CTA calculation. Okay, especially CTA is used to estimate atherosclerosis. Atherosclerosis that can increase risk of heart attack or stroke in brain patient. Okay, CTA nowadays CTA used for estimate atherosclerosis and risk of heart attack or stroke. Okay. This procedure that is CACS. Okay. Don't use contrast media to examination because if we use that, calcium will be merged in contrast agent. Okay. This is only technique in computed tomography or cardiac CT that don't use contrast media for examination. Okay. For important, if we use that, or if we use contrast media, calcium will be merged or mixed on contrast agent in cardiac CT image. After we get all CT non-contrast media, okay, เน้นนะครับ CT non-contrast media image of heart we will score slide score ก็คือการเลื่อนภาพนะครับ we will score slide by slide to find out calcium area. This slide present calcium area in coronary artery of heart. Okay, in red circle, the brightness area, that's it, calcium. Okay. Next step, we will use Attenuation score to calculate summation score from all CT slide. Okay. This slide show density weighting factor that you to multiply with calcium area in Attenuation score formula. Okay. If everyone measure calcium area in CT, we use half field unit value represent density or an intensity of calcium in coronary artery. If everyone detect half field unit or HU or CT number, around 200, we will use weighting factor to multiply with calcium area is 2, okay? For 300 is 3, and more than 400 multiplied by 4, okay? When we get a Ctr score, we will compare with this table for interpretation. After everyone calculate Ctr score, this table can interpret that. If everyone can calculate Ctr score around this, around 200 patients, that patient have moderate disease about coronary artery calcium. Okay.
Power off.
Okay, that's it. This is a 3D CT image that you to screen patient's body, muscle, and muscle aorta or artery. And this cut out only aorta and great vessel. This is aorta. Okay, that is it great vessel. This is the meaning of symbolic. Okay, this procedure had to use contrast media for create 3D structure of artery and aorta and coronary artery. Okay. For measurement or assessment of aorta and great vessel diameter or size. This is a normal dimension of aorta and great vessel. Okay. Everyone can see the part, some part of aorta and normal diameter of that part. Example is the arc of aorta. Arc of aorta normal dimension or normal diameter can measurement around 22 to 36 millimeters, okay, from CT scan image. Okay. For the next question, from cardiac computed tomography or CT. Okay. Why is or more than 64 slide CT suitable for for cardiac CT examination โอเคครับทำไมเราต้องใช้สไลด์นะครับมากกว่า64สไลด์สำหรับ cardiac CT นะครับคำถามนี้มอบให้กับเจนนิสาครับเจนนิสา
อาจารย์ได้ยินไหมคะ
ได้ยินจ้ะ
ฮัลโหล
โอ้ทำไมเสียงกล้องได้ยินครับลองใหม่ครับหายไปแล้วทำไมหนูเสียงสะท้อนโอเคไม่เป็นไรงั้นเดี๋ยวเปลี่ยนคนได้ครับงั้นขอเป็นทอฝันครับทอฝัน
อาจารย์เข้ามาแล้วค่ะ
โอเคได้เอามา
มันให้ good resolution หรือเปล่าคะมากกว่าถ้าสไลด์น้อยกว่า64
ทำไมมันถึงให้ good resolution ได้ล่ะมันเกี่ยวข้องกับแฟกเตอร์ตัวไหนกับฟังก์ชันอะไรของหัวใจทำไมมันถึงต้องใช้64ในการเก็บภาพ
heartbeat หรือเปล่าคะ
heartbeat ไม่เอ่ยใช่จ้ะโอเค they can get take good cardiac image from heartbeat phenomenon โอเคfrom the pulmonality, we use radiation to examination, but in this topic, we will use magnetic or radio wave to produce medical image, especially cardiac image by magnetic resonance imaging or MRI. Okay. In the previous slide, we will use CT, and next slide we will use MRI. Why change to MRI? Okay. Why should we change modality from CT to MRI for cardiac imaging? Because CT cannot inform good resolution of cardiac tissue or myocardial, but MRI can take that. Okay, due to MRI will detect or measurement water level or proton density in tissue that are especially cardiac tissue that can inform our tissue are normal or are not. However, all MRI cannot use to exam for cardiac part. The recommendation, we should select MRI that has magnetic strength is more than 1.5 Tesla. We will take good resolution for cardiac part. Okay. 4 Tesla is a driver unit of the magnetic induction. For everyone can compare magnetic strength in MRI with Earth magnetic field. For Earth magnetic field is 25 to 65 microtesla. Okay. For more information about Tesla and magnetic or cardiac MRI, everyone can see this QR code. For previous slide, I told MRI will detect water level in our tissue. In actually, MRI will detect proton density, that is most common component of water. Okay. If our tissue has high proton density, MRI signals tissue will be brightness image. Okay. But sometimes we would like to increase image resolution. In CT scan, we use iodinated contrast media, but for MRI, we use gadolinium, that is paramagnetic property or agent, to increase image contrast resolution in MRI. Okay, there are image compare between not used and used gadolinium. Okay, it's not used gadolinium. This is used contrast media for MRI is gadolinium. But contrast media of MRI can be used with people who are allergic to seafood or iodine. For the process, it's similar to CT scan, but we have to check pacemaker that can use with MRI because this similar to CT scan, but everyone can check this pacemaker because some pacemaker was produced to use with 1.5 Tesla MRI. Some pacemaker can use with 10 Tesla or more. Okay, so we will check that. How can we check that? Okay, the first check for medical. Everyone can check type of compatible with MRI. Everyone can check the first step, check for medical record, and second patient. Okay. The second heart normal, heart rate measurement normal level less than 60 beats per minute, and scan and interpret with by radiologist. Okay, for apply, we can use MRI to investigate cardiovascular by using still and moving picture. Okay. This is there's a view selection to just compare between general MRI. General MRI, everyone can see this slide. Okay. And cardiac MRI. In cardiac MRI, we select two short acid, horizontal long acid, and vertical long acid, and different นะครับก็คือว่าโดยสรุปในสไลด์นี้คือว่าเวลาเขาทำการตัดภาพอะครับมันจะมีชื่อเรียกไม่เหมือนกันนะเพราะว่าใน general view เนี่ยin general view we can call this line coronal, sagittal, and axial. But cardiac view, everyone can relate, or everyone have to relate slide with heart structure. This line is short acid, and this cut this direction is horizontal long acid, and cut this direction is vertical long acid นะครับก็คือว่ามันจะมีชื่อเรียกต่างกันเนาะถ้าเกิดว่าเป็นการตัดภาพใน cardiac MRI เนี่ยหรือว่า cardiac CT ก็ตามทีเนี่ยเราจะยึดตามตัวโครงสร้างของหัวใจเป็นหลักนะครับเราไม่ได้ยึดตามโครงสร้างของร่างกายภายนอกนะครับเพราะนั้นชื่อเรียกเนี่ยมันก็จะต่างไปนะครับมันก็ขึ้นอยู่กับว่าการวางแนวการสร้างภาพเป็นมิติต่างๆเนี่ยเราวางในทิศทางไหนเมื่อสัมพันธ์กับตัวของหัวใจนะครับโอเคthis slide show view selection from of cardiac part. Okay, from short acid. If we cut this direction, it's called 3-chamber view, and this direction is called 4-chamber view, and this direction is called vertical long acid. Okay, this is represent part of cardiac muscle in another direction. Okay. Okay. There are example images about MRI scan mode. In radiology, we will use two modes to scan that are T1 weighted. This is T1 weighted and T2 weighted. Okay. Easy to clarify that. If water in picture is black, this okay, the upper part not use contrast media and the lower part use contrast media. Okay. Okay. Easy to clarify. If water in picture is black, that image was scanned by T1 weighted, but water in picture is white. This water in picture is white. มันจะไม่ค่อยชัดนะ That image was scanned by T2 weighted. Okay. And it after contrast media. Okay, contrast media can increase contrast weighted or brightness of water from black to white. Okay. This is 4D MR or 4D MRI. It is rarely used in general application ก็คือส่วนใหญ่ไม่ค่อยใช้นะครับไอ้ตรงเนี้ยเพราะว่าค่อนข้างจะการสร้างภาพค่อนข้างลำบากนะครับเพราะว่าคนไข้จะต้องนอนนานมากๆนะครับโอเค for the quiz นะครับ Okay, what is the difference between contrast media contraindication of CT and MRI คำถามนี้มอบให้กับสรินพัฒน์ครับสรินพัฒน์
ค่ะฮัลโหล
จ้าตอบว่าอะไรเอ่ยมันมีความแตกต่างกันยังไงเอ่ยระหว่างข้อห้ามในการใช้ contrast media ของ CT แล้วก็ MRI
แตกต่างกันก็คือ can use in patients who are allergic to seafood and iodine
ใช่ไหมนะครับก็คือ CT ถ้าผู้ป่วยแพ้อาหารทะเลนะครับไม่ได้นะครับแล้วก็ MRI ก็ไม่ได้นะครับMRI ได้โอเคโอเคthis topic that is necessary for everyone this is ultrasound or echocardiogram Ultrasound is a kind of radiography that uses sound wave to create image by using echo phenomenon. Everyone has learned in previous week. Okay. In early technology of ultrasound, the ultrasound examination have to be done in water bath to decrease heterogeneous matter between body and air นะครับอันนี้ก็คือในอธิบายเนาะเป็นภาษาไทยก่อนช่วงแรกครับก็คือว่ามันมีปัญหาว่ามันไม่สามารถลดเรื่องแก็บระหว่างตัวโพรบกับตัวผิวหนังได้ครับเขาก็เลยต้องให้คนไข้ไปนอนไปอยู่ในน้ำเพื่อให้มันเกิดความสมูทแต่ในอาทิตย์ที่ผ่านมาเราเรียนแล้วเนาะว่าหัวโพรบเนี่ยมันเพิ่มส่วนที่เราเรียกว่า matching layer ขึ้นมาในส่วนหน้าครับตัวเนี้ยมันจะช่วยลดปัญหาดังกล่าวจึงทำให้ในปัจจุบันเนี่ยเราไม่ต้องนำคนไข้ไปไว้ในอ่างน้ำเวลาตรวจอัลตราซาวด์แล้วนะครับแล้วก็มีการใช้พวกเจลร่วมด้วยนะครับโอเค This factor acoustic impedance or set is one of parameters used for forecasting sound resistance that can help us in the diagnosis. Okay. In general, ultrasound beam will be absorbed by tissue and decrease its intensity around 1 decibel per centimeter per megahertz. Okay, and we had a study in previous week. Okay. The final topic in this section, this is nuclear medicine. For nuclear medicine, this procedure is only examination that inject or drink radiopharmaceutical in patient body and using for physiology examination with scanner such as SPECT or PET. This is a SPECT for specialized for cardiac specialized. Okay. Okay. For cardiology, we will use SPECT to investigate myocardial and heart blood flow or heart blood perfusion function. That is blood pumping to another organ by using radiopharmaceutical that's named technetium-99m maybe or maybe. Maybe it stands for maybe that is specific drug or specific agent to the heart or myocardial muscle นะครับคำว่าตัวนี้นะครับเวลาเราต้องการให้ตัวรังสีหรือว่า radiopharmaceutical มันเข้าไปที่ต่างๆเนี่ยมันต้องมีการนำตัวเราเรียกว่าสารกัมมันตรังสีนะครับติดไปกับตัวยาที่มันมีความเฉพาะเจาะจงกับอวัยวะนั้นๆในที่นี้การตรวจกล้ามเนื้อหัวใจเนี่ยตัวยาที่มีความเฉพาะเจาะจงคือตัวมีบี้หรือว่าเซนตามีบี้นะครับซึ่งพอติดเข้าไปกับตัว radiopharmaceutical ตรงเนี้ยที่เป็น Technetium-99m เนี่ยมันจะเป็นตัวนำพาตัวเทคนิเชียมเนี่ยไปอยู่ที่กล้ามเนื้อหัวใจและทำให้เราเห็นการทำงานของกล้ามเนื้อหัวใจนะครับ For the process of nuclear medicine this line okay the first don't stop taking your medicine until your doctor tell you to and don't eat caffeine content or NPO นะครับ before examination around 4 to 6 hours okay wear comfortable okay and wear shoes exercise shoes What's the most common technique in cardiac nuclear medicine is myocardial perfusion imaging or MPI that you to estimate about heart muscle or myocardial and using to diagnose and clarify between ischemia and infarct. Okay. Fourth step. Patient will be take two steps. The first step is rest state. Rest ก็คือพักนะครับนอนเฉยๆ We will take patient will be tested or exam without active situation. And second step is state. Patient will exercise before test to activate his heart function for find out abnormal sign when patient heart work hard. Okay, this is state. Okay. For MPI test, patient will be examined by two steps, rest step and state step. Okay. For the state step, before test by this machine, patient will exercise. Okay, and next step, test by this machine. Okay, for interpretation, myocardial perfusion imaging, and there are imaging output from myocardial perfusion imaging. The view selection is similar to general cardiac view. Okay, everyone have to compare between rest state and state rate. Okay. If everyone can see fixed perfusion defect, that is myocardial infarction, and but everyone can see transient or reversible perfusion defect, that is myocardial ischemia. Okay, for interpretation, that is the good slide for that information. For interpretation at the same area, example, this blue area and this red area. Okay, blue area represent abnormal area and red area represent normal area of myocardial. Okay, at the same area of heart between state and rest, we will look on blue area that represent non-active muscle or abnormal area. If state have blue area but don't in rest state. Okay, stress state have blue area and red state don't have okay does it myocardial ischemia ครับภาษาไทยเราเรียกว่ากล้ามเนื้อหัวใจขาดเลือดชั่วคราวนะครับ In another hand if it may have blue area okay have blue area on both state and rest does it myocardial infarction นะครับภาษาไทยเรียกว่ากล้ามเนื้อหัวใจขาดเลือดหรือว่ากล้ามเนื้อหัวใจตายนะครับOkay, this is the final quiz. Okay. What is the main purpose of nuclear medicine to use for cardiac examination? The final quiz for บุญเรียกอย่างเรียกปกติขวัญข้าวครับขวัญข้าว
ฮัลโหลค่ะ
จะจุดประสงค์หลักการตรวจนิวเคลียร์เมดิซีนคืออะไร
Is it like to identify the disease at the earliest stage and like how well your heart is pumping?
มันก็ใช่นะแต่แล้ว the main purpose มันล่ะอันนั้นเป็น application for the main purpose is ได้ไหมเอ่ย
ฮัลโหลได้ยินไหมคะ
ได้ยินจ้ะที่
It's
เรา
like to pinpoint a molecular activity.
เราเรียกว่า physiology นะครับก็คือ the main purpose of nuclear medicine especially in cardiac examination we will use that to check physiology of heart especially for application to apply to the myocardial function by myocardial perfusion imaging Okay this is reference นะครับก็คือเราหาในห้องสมุดแพทย์น่าจะมีนะครับพวกหนังสือพวกนี้ลองไปหาดูได้นะครับหรือว่าถ้าไม่สะดวกหาก็ดูตามเว็บพวกนี้ได้นะครับก็วันนี้กี่โมงเนี่ยเหมือนตัวเองสอนเร็วไปเนี่ยโอเคนะครับวันนี้ก็มีเท่านี้นะครับสำหรับตัว radio นะครับ radiography นะครับซึ่งตัวโซโนกราฟีก็ลงรายละเอียดเฉพาะทางสำหรับ Echocardiogram ไปแล้วเมื่ออาทิตย์ที่ผ่านมาครับถ้างั้นวันนี้ก็เท่านี้นะครับถ้ามีข้อสงสัยทำได้หรือว่าถ้ายังนึกไม่ออกก็ส่งเมลมานะครับแล้วก็เดี๋ยววิดีโอจะแชร์ไปให้น่าจะอีกประมาณ1ชั่วโมงครับเดี๋ยวตัว Google Meet มันจะทำการประมวลผลก่อนนะครับเพราะงั้นวันนี้ก็เท่านี้นะครับขอบคุณทุกคนมากนะครับ
ขอบคุณอาจารย์มากค่ะ
ขอบคุณค่ะ
โอ้คนหายไปเร็ว